I'm Mr Zaid Shalchi, and today we're going to be talking about ophthalmic shingles, which is also termed herpes zoster ophtalmicus. So shingles occurs in patients who have previously had chickenpox. It's caused by the herpes zoster virus, which can reside in the nerves for many years. When this virus reactivates, it leads to shingles in an area served by that nerve. When the ophthalmic nerve is affected, it's termed ophthalmic shingles or herpes zoster ophtalmicus. The condition typically affects those above the age of 50 years or those with a weakened immune system. The first symptom of ophthalmic shingles is a rash affecting one side of the forehead, scalp, and the upper eyelid. So the rash typically affects the forehead over here but respects the midline. The rash may also affect the nose. The rash typically starts with pain and tenderness before showing blisters and then crusting over that usually resolves within about 3 to 6 weeks. In half of patients, the eyeball may be affected and can become red, swollen, sensitive to light, and the vision may become blurred. So ophthalmic shingles should be treated with antiviral tablets for about 7 to 10 days, and these can be started by the GP. The treatment works best if it is started within 72 hours of the rash first appearing. The treatment helps reduce the severity of the disease and any complications to the eye. Many people ask about whether the condition is contagious. Well, shingles is caused, as we said, by the herpes zoster virus, which is also the cause of chickenpox. It's contagious whilst the rash is in the blistering wet phase. Others who've had the chickenpox previously are relatively immune to new infection, as well as those who have received the shingles vaccine. Newborns and those with a weakened immune system are at highest risk of new infection. Now, shingles or ophthalmic shingles can affect the eye in about half of patients. The most common complication is conjunctivitis, where the eye becomes red and swollen. The cornea may also be affected by ulceration and inflammation, and this is called keratitis. The eye pressure may become raised, and inflammatory eye disease or uveitis may also occur. The most serious complication of ophthalmic shingles is inflammation of the retina or acute retinal necrosis, as well as when the optic nerve is involved. Many of these conditions require urgent treatment to prevent sight loss.